I'm Dr. Lindsey Hanson. They asked me to do a talk about summer health, and that was pretty broad. And so I kind of thought about what I get a lot of questions about, and so like sunscreen is a big one. And so we're going to kind of delve into that today. So the first thing I'm going to talk a little bit about is just skin cancers, which is kind of why we get into sunscreen and sun safety. So essentially what happens is you get these UV rays from the sun, and they overwhelm your skin's ability to repair itself. So that leads to genetic mutations, the cells then misbehave, and eventually they can turn into tumors or cancer. So about 1 in 5 Americans get skin cancer by the time they're 70, so it's a lot. And if you took everybody who got a cancer diagnosis in a year, more people get diagnosed with skin cancer than all the other cancers combined. So very prevalent. Most skin cancers are from sun or from tanning beds. And so for that reason, it's a very preventable cancer. Having 5 or more severe sunburns in your life doubles your risk of developing melanoma, which is the worst skin cancer. If you get 1 blistering sunburn in childhood, just 1, that will double your risk of melanoma later in life. So that's why we talk a lot about sunscreen in kids and sun safety. There are essentially 3 kinds of skin cancers. There's basal cell, squamous cell, and melanoma. And overall, there's about a 99% cure rate with skin cancer. So it's something that we want to catch early. And so I'm just going to quick talk about the ABCDE rule when you're looking at moles, looking at your skin, any skin lesions. So A, if you have a mole that's asymmetric, so one side looks different than the other, that can be concerning. B stands for border. So we like moles that have a nice smooth edge around them. If it's really jagged or irregular, that can be a concerning sign. C is color. So typically your nice benign, non-concerning moles have one color. They're nice brown or red. But if they have lots of different colors, we call it color variation, that can be a concerning sign. D is diameter. So a good rule of thumb is if it's bigger than the size of your pencil eraser, that would make it a more concerning mole. And then elevation. So if your mole is raised above the skin and it's really rough to touch, that can also be a concerning sign. And then other things we tell people when you're looking at your skin, if you get a mole that bleeds a lot, something that just won't heal, it looks like a sore, but it just won't heal, keeps coming back, if it's really scaly or crusty, any of those things are things that I would encourage you to have your provider look at. Okay. So then I'm going to go into sunscreens. Do you guys have any other questions about just skin cancer in general before I move on?
Will they be having another screening? Because it seems like I went in for the screening on the first day that I saw it in the newspaper, and it was filled already. Do they have those often?
It's a great Molly question.
I don't think this year they're going to have another one through outreach, but you can always reach out to your primary care provider, and they can do one as well.
So they can do it as well. You don't need that person to do it, any of you.
Mm-hmm. Or if there's anything concerning, we can always set you up with that person. Yep.
Thank you.
Yep. Any other questions? Okay. So then we're going to talk a lot about sunscreens because it's kind of actually, the more you look into it, the more kind of confusing it is. So I'm just going to kind of teach you about what I've learned about it, and we'll see what questions you guys have too. So when we talk about sunscreens, the first thing people think about is your SPF. So SPF stands for sun protection factor. SPF is only talking about UVB control. So there's 2 kinds of radiation, UVA and UVB. So UVA, think about A for aging. So UVA rays are going to cause more aging, like wrinkles, whereas the UVB is the sunburn. But both of them actually are really important. So sunscreen, SPF, is only talking about the sunburn. It doesn't talk at all about the damage to your skin as far as the aging. So to calculate out the number that they get, let's say that you have this based on your skin type. In 10 minutes, it'll take you 10 minutes without any sunscreen to burn. So if you have an SPF of 15, you go 10 times 15, that sunscreen, if applied correctly, should let you go 150 minutes outside without burning. There's a lot of variation with that though, like depending on the rays in the sky that day and your skin tone and lots of things. So they don't really go by that, but that's just a general idea of where these numbers even come from. The American Cancer Society recommends an SPF of 15. The American Academy of Dermatology recommends an SPF of 30. So differing guidelines depending on which organization you follow. But it's pretty solid that no one recommends going above an SPF of 50. And you'll see like SPF 100 out there. The reason that they don't recommend going above 50 is there's a few things. One is the higher the SPF, the more issues we have with like allergies, so people having allergic reactions to the ingredients. Another is that it's very misleading. So people think if you're wearing an SPF 100, you can't possibly burn, and that's definitely not true. They also find that as you get above 50, the SPF, the protection from it is really only focusing on those UVB rays, the sunburn rays, but you're not getting any more increase in the coverage for the UVA rays, which also is important for like your skin cancer prevention. And then they actually say that going from an SPF of 50 to SPF of 100, your increase in coverage is very marginal. So an SPF 50 blocks 98% of those rays, and SPF of 100 blocks 99%. So you're really not gaining anything, and a lot of times they cost more. So they really, really discourage anything above 50. See, the biggest issue or concern that they talk about with sunscreen is that most people don't apply nearly enough. So you're supposed to apply an ounce or more across your body each time. So I saw 3 different ways that they describe an ounce. One is a palm size, one is a golf ball size, and one is a shot glass. So any of those you can think about, that's how much you're supposed to apply every time. And then you're supposed to, it says apply every 2 hours, but if you're sweating, if you're swimming, if you're toweling off, you really need to apply more often than that because all of those things will decrease your sunscreen use faster. And yep.
I apply heavily in the morning.
Yep.
And I don't touch it all day. And, you know, why would it only last 2 hours? What happens?
Yeah, I think your body kind of, some of it evaporates off, some of it sweats off. Yeah, it doesn't stay on you all day long.
Every 2 hours?
Yeah, that's really if you're going to be out in direct sunlight, like if you're out in the garden or at the lake. Yeah, yep. If you look at the bottles of sunscreen, they're no longer allowed to say waterproof or sweat proof because that also is very misleading. So you'll see it'll say sweat resistant or water resistant. And the highest rating any sunscreen can have is a water resistance of 80 minutes. That's the best, you can't go above that. And so that just really shows 80 minutes, that's not 2 hours. So when you're, say, at the pool, you know, toweling off in between your breaks, you probably should be reapplying at every break. One question that I always have when it gets to be mosquito season is about bug spray and where does bug spray and sunscreen, how does that go together? So they've actually stopped making bug spray and sunscreens together because you probably need to be reapplying sunscreen a lot more often than the bug spray, or maybe the time of day when you're wearing sunscreen you don't need bug spray. And some of the sunscreens will make you absorb chemicals more easily, which is not a good thing. So they say apply your bug spray first, then your sunscreen on top of that. Another thing with sunscreen is to really have it be effective, you're supposed to put it on 15 to 30 minutes before your sun exposure. And that's especially true if you're going to be going swimming, getting wet. You really want to give your body time to use it before you hop in the pool. What else? So beyond sunscreen, other things that we talk about for sun protection is really avoiding the prime time of sun, which would be from 10 a.m. to 4 p.m. when the UVA, UVB rays are the strongest. Remembering, because you can burn even if it's overcast. You even can burn through certain types of clothes. Protective clothing like that wonderful hat she was wearing, those with the wide brim, because if you think about baseball hats, the back of your neck is exposed and your ears are exposed. Ears are probably one of the number one places that we find skin cancers because they're just sitting out there. Nobody remembers to sunscreen them. They get burned all the time. So trying to protect those areas as well.
What about shirts that say they're UV protected?
Yeah, yep.
Are they-
Yeah, there's some really good shirts out there. And they actually even have ratings as far as like how much protection they give. And that depends like on the quality, like the material that they're made out of, how tight it's made. If it's wet, sometimes that decreases how effective it is. There's a lot of things that go into that, but yeah, clothes are, so that's why swim shirts are a really big thing now. And I, like my kids wear swim shirts because I tell them if you put this shirt on, then I don't have to fight you with all of that area of sunscreen. And so it's a good compromise.
So do they last wash after wash?
I'm sure it depends on the brand. Like for me, the ones that my kids wear, I just hang dry them and they last very well. Yeah, but I'm sure it depends. Yeah. Yep. There's different kinds of sunscreen, and my kids always complain if I buy mineral sunscreen because it's too white. They don't like how white it is. But from a safety standpoint, probably the mineral sunscreens are actually the safest for you. So this handout that I gave you, this is from a nonprofit called the Environmental Working Group. So because sunscreens are over the counter, they're not necessarily like FDA studied, they're not regulated. And so this nonprofit group evaluates all of their safety. Are they actually the SPF that they say they are? What chemicals are in them? And so I printed off, they have different lists, and so there's more on these lists if you go to their website, but like these are their best rated daily use sunscreens, recreational use sunscreens, non-mineral sunscreens, and baby sunscreens. And so they really push for the mineral sunscreens because of the safety of the zinc oxide and titanium oxide that's in them. But because I'm sure a lot of people are like my kids and complain, I like that they have the non-mineral as an option. So with the non-mineral sunscreens, there's lots of different ingredients that go into them. And the most worrisome ingredient is probably oxybenzone. So the concern with these is that they get absorbed by your skin. We can actually find them in your bloodstream. And that one in particular has some endocrine changing properties. So like probably has some reproductive issues down the road. And so they really, really discourage that one in particular. Whereas the zinc oxide and titanium, we don't absorb those. Yeah.
What's the difference between how you'd recommend using a daily use versus a recreational?
Yeah, so I would say generally a daily use is something that you're looking for like your face, like what you put on every morning before you head out. And your recreational is probably more what you're going to buy in like a larger amount because you're going to be putting it on when you go to the lake or the pool or whatever. They caution you about like baby sunscreens that most of the time when products are like selling it as a kid sunscreen or a baby sunscreen, it's probably the same ingredients as your family sunscreen, but it's marketed cuter, and so you're paying more for the same thing. So they do talk about that, and I do think that's true. So the whiteness from these mineral sunscreens. So that was something I really wanted to dig into because if we're supposed to be using these how do we make them so that people tolerate them? You know, it's fine that we're supposed to use them, but if nobody wants to be walking around with a white face. And so there's a few tricks that they've kind of come up with that has made it a lot more tolerable. So one is that a lot of sunscreens have started tinting, and so essentially when they put tint in, they're using iron oxide, and that neutralizes that white hue. So, well, everybody gets a sunscreen today, and so this brand that I found, Think Sport, I personally bought the daily face one that has tint in it, and so you can see it comes out kind of brownish, and so that's like what I'm wearing right now, and I don't think I have a white face. So that's a pretty helpful tip, the tinting.
And you use that just
Yeah, so I put this on every morning.
like almost a base thing, a
Yeah.
moisturizer then?
Yeah.
Okay.
Yep, I only do it in the summer just because I go out like walking, but yep. And then another trick that they found is they'll mill the zinc oxide down to these much, much smaller particles. And so that's called microionizing. And so when they do that, then it's not nearly as white. And so on the bottle, it'll say like sheer or invisible. And that's what they're doing with that, so to make it less white. And then one other thing that some companies are trying is changing the texture so it's more of an evaporative texture. So like a serum or more fluid like lotion, so that doesn't clump up under your skin to make it that white either. So a few tips they suggest is doing layers. So starting with a thin layer, getting that fully rubbed in before putting on the second layer. So don't try to put it all on at once. Warming it up in your palms first actually will make it easier. And then having a well-hydrated face. So if your face is really dry, it's going to be much more clumpy and white, whereas if your face is moisturized, it'll grip those mineral particles better. So, yeah.